You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry. What's new? With us, we have two dentists, father and son, Dr. Ira Schecter and Dr. Micheal Schecter. Welcome to the program.
How you doing, Randy?
All right. Now, what do they call you in your practice, by the way? They call you Dr. Micheal, they call him Dr. Ira. What do they say?
Whatever they want, but usually it's Ira and Micheal.
Now, you've been in practice for how many years? Over 30 years?
Since graduated in 1979, I've been in private practice since 1980 because I did a one-year surgical residency program before I went into private practice.
Okay, good. Now, before we get into today's topic, comprehensive dentistry, tell us about your practice. I mean, what kind of patients are you seeing? What's the wide range?
We actually see patients of all ages. We have little kids coming in, and we have geriatric patients well into their 90s even.
So you do everything, I mean, from dental implants, I guess you do fillings, cosmetic dentistry?
I think we really attract patients that are motivated by their health. You know, people that come in and they want to have healthy mouths, healthy bodies, and they come in seeking that comprehensive care.
Now, you both have nice teeth, right? Let's take a look at, very nice teeth. Now, your son, I mean, what role does he have in the practice? And
my son has actually been I think a great source of new energy for me. He's brought
How so?
Well, he's brought some new technology to the practice. He's introduced a whole new concept of treatment planning or treatment approach with respect to more preventative care. And okay. Micheal can probably explain that better, but it's a great option that we offer our patients.
All right, now, you know, we were talking off camera. You said probably the greatest compliment, I'm quoting you, about your son is that, you know, if you go away and decide to retire, they're fully confident in his ability. I mean, you hear that? They say that?
They absolutely do, and you have to understand that the type of practice I've built, it's almost an umbilical cord that
okay.
I've remained connected with my patients. I don't shy away from treating my patients after hours if they need emergency care. My patients get my cell phone number as part of their post-op.
Is that right? Your
Absolutely. It's on the post-op sheet. And if I get a call in the middle of the night and I have to go in, which doesn't happen very often, I don't think it's happened really in the last number of years because we're very careful to try and prevent those type of problems, we deal with it. And the fact that now if I go away, and I'm doing a lot of traveling, teaching, and lecturing, Michael's there full-time. So patients are introduced to a different body, but the same philosophy and the same continuity of care.
Now, Micheal, did you always know you wanted to be a dentist? You saw your father. Did you work in the practice?
Well, I think it's been just a gradual progression, right? I've always been interested in dentistry, interested in health, and I've slowly developed this idea where we can take a holistic approach to dentistry.
Are you a holistic dentist, a biological dentist?
I like to use
There's a lot of names for it.
I like to use the phrase biological dentist. I think it's a dentist that takes a comprehensive approach to dentistry, but does it from a science-rooted format.
I think, Randy, the important thing is that our patients get options.
Now, both of you are really into technology. I mean, all the new stuff.
Absolutely.
Does that make a big difference?
You know, we've always been accused of being gadget guys. And I have patients who come in and they sit there and I have to get them to stop playing with the toys, as they call them, so that I can actually do the work. But I think the important thing is that we've always wanted to give our patients the best quality of care. And you can't deny that new technology, digital radiography, for example.
So all of this technology, is it for lower downtime? Better results, less pain?
I think it's a combination of things. The digital x-rays, for example, it's 50 to 90% less radiation than standard x-rays, so it's much less invasive for the patient. It also has eliminated the lead or chemicals that we need to develop the x-rays. In our office, we've eliminated the two major sources of waste in the dental office. We've gotten rid of the mercury from the amalgam fillings, and we've gotten rid of the lead packets from the digital
Does that still
x-rays.
go on, by the way, in Canada, the mercury or amalgam metal fillings?
Well, the controversy, I think, is worldwide.
But does it go on? I mean, are there still dentists that use those?
Oh, absolutely.
Oh, really? Okay.
And you know, if you look at what's going on around the world, there's countries in Scandinavia that have banned the use of mercury amalgam fillings. It's still taught here in North America.
So
in
white
the dental
fillings?
Schools. We're using white fillings only, and I was actually the very first general dentist in Toronto, I'm proud to say, that got on the so-called alternative filling bandwagon back in 1986, where I was commissioned to do an in-office pilot study by one of the manufacturers.
Now, Dr. Ira, you lecture to other dentists internationally. What are your topics?
Well, I've been teaching other dentists basically how to incorporate dental implants into their everyday treatment planning. But as well, I like to tailor my programs to the general dentist so that they can actually learn treatment planning skills as well. And they can learn how to think a little bit the way I practice, which is the best thing I can give an audience when I'm lecturing.
Now, what are some of the places that you lecture?
Well, I've been as far away as India, and
To other dentists there in India?
other dentists. We had 300 dentists at a dental college in Hyderabad, India last year, and then I taught a 3-day postgraduate program to 60 graduate Indian dentists there. I also taught in other places in Delhi and Mumbai.
So dentists from all over the world want to hear what you have to say in regard to placing dental implants, the surgical part, the restoration, as you put it.
I think it's the whole package. What we offer, or what I offer the dentists in my lectures, is what they could do. And they just have to learn, they obviously have to learn the technical skills how to place a dental implant, but more important than that, it's the treatment planning. They have to learn how to diagnose when to place an implant, when to extract a tooth, when to save teeth, when to combine implants with teeth. We today are really not robotic anymore about...
They don't teach this in dental school? I mean, did you learn the stuff that he's lecturing on?
I was going to say, I mean, as a continuing student of my dad's, I would say that he really gives you that thought process, and should give you the tools in school, right? They teach you how to place a filling. The implants hasn't really come to the university in Toronto yet,
okay.
but some of the other things they definitely show you. But in terms of taking a look at a mouth overall and saying, how do I want to plan to make this person healthier, more comfortable, able to chew, that type of comprehensive treatment planning just isn't available.
Okay.
And
do you go to his lectures, by the way?
Absolutely.
Do they bore you because he's your father?
Well, you know, a little bit maybe.
He only gets embarrassed when I introduce him to the audience.
Now, do you guys talk about dentistry when you're at home at the table? I mean, are you guys always talking about it?
We try not to, out of respect for everyone else, because it can be very boring. We understand for an outsider.
But you love it. I mean, both of you love it.
I've often said if I didn't have the passion that I have today to do what I'm doing, I would stop doing it, because then it wouldn't be fair to the patient.
Are people still afraid of going to the dentist, like this dental phobia? Do you hear that?
I think it's definitely still there. A lot of people are just plain phobic, like you say, about coming to the dentist. But we have different means and tools to make them more comfortable. I think the first thing is our approach. We're very approachable people, we're very calm, and we put people at ease in the chair.
I think patients develop a dependency on a lot of their professionals. And the fact that they can get mostly all of their dental needs taken care of under one roof, in one facility, with the same
So
deliverer.
that's your message. That's your message. I mean, this comprehensive approach under one roof, you could do it.
And then also in terms of anxiety, I mean, we have some additional tools to make the patient more comfortable. I practice homeopathy, and there are different homeopathic remedies that, while they're non-invasive and non-toxic, can trigger the body to heal, trigger the body to relax, and allow the procedure to be a lot more comfortable.
Is it less painful, even in the last 5 years, is it less painful to dentist than it was 10 years ago today?
Oh,
Is pain almost behind us now?
Pain is unnecessary.
Okay.
And the problem is that when people experience pain, tooth pain is horrific.
Okay.
And they usually experience tooth pain because they've allowed things to be neglected to the point where the disease process has invaded the nerve space of the tooth, or the infection that's around the tooth has become so profound that they can't tolerate the pressure that it's eliciting. And really what we're trying to do in building our rapport with our patients is to get them to address what they perceive to be something abnormal right away. And if there's even the slightest concern, we want them to contact us.
So in Toronto, are there people out there that have tooth pain that are just living with it because of the fear of the dentist, and they don't realize that they could go in and it's gone?
Absolutely.
Is that an overstatement, that they could go in and you could help take that away?
We can get rid of pain
make them
instantaneously. We can get people comfortable. We can, as long as we have the opportunity to assess it, to diagnose it, and to figure out what's going on. We'll deal with their emergency situation right on the spot. We'll never turn away an emergency. And then what we do is we try and get them to come back so we can do a comprehensive assessment of everything else that's going on.